So I'm Dan Munro here at the Digital Health Summit at CES, and very excited to be talking with Dr. Otis Brawley, whose book, How We Do Harm, was written last year and is one of the tougher books to read, but I think should be required reading for all of us in the healthcare space. So Dr. Brawley just finished up a panel here at the Digital Health Summit, and we wanted to take this time to ask him a few questions. So, Otis, from your book, on the panel you made a reference to the cultural changes that we need to make as a country relative to healthcare and healthcare costs. Can you talk a little bit about that relative to what the changes are culturally that you think we need to make?
Yeah, one of the great problems that we have right now in the United States is the obesity epidemic. We're consuming lots of calories, not doing a lot of exercise to burn them off, and as a result our healthcare bill is going to go up dramatically over the next 30 to 40 years because of it. One of the reasons that this has happened is because our culture in the United States has gotten away from exercise and gotten away from physical activity. 50 years ago, very few families had a family car. Now many families have 2 and 3 automobiles. People didn't live in suburbs that have no sidewalks. People lived in cities and walked, or lived on farms or ranches and actually got physical exercise. We need to try to change our culture back toward appreciating physical activity and exercise.
Great points. The other statistics that I think you talked about relative to cancer specifically was the reduction in cancer mortalities that we're seeing. So can you talk a little bit about that relative to not only the reduction in rates, but then also what can we attribute that to?
Yeah, there's been a 20% decline in cancer mortality from 1991 to 2010, 2010 being the last year that we actually have data. That decline in mortality is largely driven by prevention activities, smoking cessation, and people who decided not to smoke in the 1960s, 70s, and 80s, not getting cancer in the 1990s and beyond. It's also driven by some improvements in treatment and some screening. For example, in breast cancer, it's a combination of treatment as well as screening that's led to a 35% decline in breast cancer death rates. All of this is really good news. However, I'm really concerned that the obesity epidemic actually causes cancer. Many people know it causes diabetes and heart disease. It really causes a lot of chronic disease, including cancer. And while we've got this decline in mortality, we've got the obesity epidemic pushing up ever so slightly right now. And as we go off into the next 10 to 15 years, we may find that the mortality rate from cancer is starting to go up because of the obesity epidemic.
Yeah, and that's something that we all need to be aware of. The other thing is that this last year, you wrote the book, which is How We Do Harm. Is there a sequel in the works, and what can you tell us about that?
Yeah, Paul Goldberg, my co-author, and I are working on a book called, tentatively called Race Medicine, and it's all about how our concept of race is actually interfering with all of our health, and how healthcare in the United States is really hurt by the fact that we have these really wrong, misguided views of what race is and how race interacts with healthcare.
Perfect. And when can we expect that?
I'm hoping that it's going to be out sometime in early 2014.
We'll follow up and make sure that we get that release out to the general audience. So I know that you have to leave. There's a flight, and I think it's back to DC. Can you tell us what's next for Otis?
Yeah, I'm going to DC tonight because tomorrow the chief medical officers of the American Heart Association, the American Diabetes Association, and the American Cancer Society have our twice-a-year meeting where we get together and we talk about how we can work better to prevent these diseases. As I said earlier, The combination of high caloric intake, lack of physical activity, and obesity, that three-legged stool, is actually causing a tsunami of chronic disease, heart disease, diabetes, and cancer. Many people don't realize that obesity actually does cause cancer, causes at least 12 different cancers, by the way. And so tomorrow's meeting is one of a series of meetings where we're trying to figure out how we can all work together, all of the healthcare societies, to try to improve health in the United States.
Perfect. So we thank you very much for joining us, and important work on the road ahead. And we're thrilled to have you head it up, or parts of it anyway, certainly as it relates to the American Cancer Society.
Thank you so much.
Again, Dan Munro at the Digital Health Summit here at CES.